It's very important because prostate cancer is the leading cancer diagnosed in men in Africa. To understand how we can screen men for prostate cancer so that they can be diagnosed at a treatable stage. And to do that, we need screening modalities, we need laboratory facilities, we need diagnostic facilities, and we need treatment facilities. So my talk is really about the need for those features, for those capacities, and then to be able to start thinking about how we can develop and implement them in a low resource setting in most parts of Africa. As I've said in my talk, in order to bring prostate cancer diagnosis, screening, and treatment into the 21st century, there is a lot of need. There are many pieces of this puzzle that need to be thought through. And the choosing wisely concept is one that we really need to think carefully about, because we can't do everything. A lot of the things that I've spoken about in my talk are very expensive. They require a lot of development and infrastructure. And while we want to bring cancer care and cancer treatment into the 21st century, we really need to think about where we can invest, what we can and cannot invest in because it's too expensive, or the yield, the return on those investments is going to be too small. So in my talk, I tried to give some sense about what is needed if we want to bring Africa to the state of care in the rest of the world. Now I think the discussion needs to be how we start making those choices, and how we start thinking about where we need to invest and what we really can't yet invest in because it's just too much for the moment. I think it's really important for us to start thinking about how to bring 21st century care to Africa. It's going to be expensive, it's going to be difficult, but Africans deserve a care at the level of everyone else in the world. And we need to start thinking now about how to incorporate that into current health systems, perhaps by leapfrogging, perhaps by thinking about novel ways of implementing these very sophisticated molecular and therapeutic tools in a setting where they can actually be benefiting Africans. And that's something that I think we need a lot of debate about at the moment, so that we can make sure that it happens in a reasonable time frame.